Part 2 of Lesson 6, talking about muscle, bone, and joint injuries. Injuries to muscles, bones, and joints include sprains, strains, dislocations, and fractures. A sprain occurs when a ligament is stretched, torn, or damaged. Um, Ligaments connect bones to bones at the joints. A strain occurs when a muscle or tendon is stretched, torn, or damaged. Tendons attach muscles to bones. Strains often involve the muscles in the neck, back, and legs. Dislocation occurs when the bones that meet at a joint move out of their normal position. A fracture is a complete break, chip, or crack in a bone. For anyone who has experienced muscle, bone, or joint injury, signs and symptoms are usually pain, swelling, bruising, and an inability and unwillingness to move that injured body part. The injured body part could also be bent, crooked, or otherwise deformed. There could have been a popping or a snapping noise or feeling, and there could be some grating noise and feelings as well. Every muscle, bone, or joint injury will not necessarily need 911. However, if a bone is broken and protruding through the skin, if it's bent or crooked, if there's moderate severe swelling and bruising, you should call 911. You should also call them if the person heard or felt a pop and a snap at the time. If they hear that grating sound, if they can't move the injured body part, if the area is cold and numb, if it involves the head, neck, or the spine, and if the person is having trouble breathing. Also call 911 if the person is showing signs and symptoms of shock, if the injury makes you think that it may be more severe than it appears, and if they have multiple injuries, and if it is not possible to safely and comfortably move the person to a vehicle to transport to medical care. General first aid care is the same for all types of muscle, bone, and joint injuries. If you have called 911 and you're waiting for EMS personnel to arrive, you're going to want to have the person rest without moving or straining the body part. If the person can tolerate it, apply a cold pack wrapped in a thin, dry towel to the area and reduce swelling and pain. To make a cold pack, fill a sealable plastic bag with a mixture of ice and water. Apply 20 seconds on or 20 minutes on, 20 minutes off. In some cases, it may be necessary for the person to see a healthcare provider. If calling EMS is unnecessary, you can use the mnemonic RICE to help you remember how to care for a muscle, bone, and joint injury. R stands for rest, limit the use of the injured body part. I is immobilization, stabilize the injured body part with an elastic bandage or a splint to limit motion. C is cold, apply a cold pack wrapped in a thin dry towel to the area to reduce swelling and pain. Apply cold for no more than 20 minutes at a time and wait 20 minutes before applying cold again. E is elevation. Elevating the injured body part may help reduce the swelling. Only elevate the injured body part if it has been immobilized or splinted. Do not elevate injured body part if doing so causes more pain. Head, neck, and spinal injuries. Traumatic accidents such as falling from heights, getting hit by or being thrown from a vehicle, or a blow to the head can cause head, neck, and spinal injuries. Head, neck, and spinal injuries can be serious and may result in permanent disability or death. If you suspect a person has a head, neck, or spinal injury, call 911, and as long as the person is breathing normally, have him or her remain in the position in which they were found. Some signs and symptoms of head and neck and spinal injuries include the mechanism of injury. So, for example, if they fell from a height, if they have, or if they were thrown from a car, there's a broken safety helmet, or if there's loss of consciousness. They have behaviors similar to that of a person under the influence of alcohol or drugs. Head or neck and back pain, or partial or complete loss of sensation or movement in part of the body. Bumps, bruises, or a depressed area on the head, neck, and spine. Blood tinge or clear fluids leaking from the ears and nose, bruising around the eyes and ears, impaired breathing, blurred vision, sensitivity to light, and seizures. If you think that a person has head, neck, and spinal injuries, call 911. Approach the person from the front so that the person can see you without turning their head, and tell the person to respond verbally to your questions rather than nodding or shaking their heads. Have the person remain in the position in which they were found until EMS arrive and take over. If they're wearing a helmet, do not remove it unless you have been specifically trained on how to do so, and if it's necessary to remove the helmet to give CPR. All right, so concussions. A traumatic brain injury that alters the way the brain functions can be caused by a bump, blow, or jolt to the head or body that results in rapid movements of the head. It can happen in a minor accident, doesn't have to be something huge. It can also not be obvious right away. So sometimes the effects of a concussion are not seen for hours and even days. They don't always lose consciousness, so that's good to know. Some people who have sustained a concussion may lose consciousness briefly, but not everybody does. Some signs and symptoms of a concussion can be grouped into 4 categories: thinking and remembering, physical, emotional, and behavioral. Thinking and remembering, the person may seem dazed and confused and out of it. Physical, they may feel nauseous and vomit, complain of a headache and sensitivity to light. Emotional, they may seem irritable, sad, or agitated if they normally wouldn't. And then behavioral, they may sleep more and change some eating habits and playing habits if it is a child. If a person has sustained an injury that could cause a concussion, even if the person is not showing any signs and symptoms, they should be seen by a healthcare provider. And that is all for part 2 of lesson 6. So your final word of the day is flower. That is your second word.